what are you doing from a lifestyle standpoint? Are you physically active? Because that's so important. How are you eating? Are you eating too much? Alcohol use. And then we'll look more at things at blood work, although still lipids, cholesterol panel, and blood sugar are the keys, but I'll check kidney function for sure, and maybe blood counts if it seems appropriate, maybe a thyroid screen if it seems appropriate.
Yeah, so there are things that you can begin to think about. How's the thyroid? How's the metabolic function? What's their sleep pattern? What do they look like? How vibrant do they look when you're talking with them? Do all those things fit into your evaluation?
Absolutely, absolutely. And you'll get a sense of, and again, I keep coming back to the physical activity, but I think any activity is good, and it doesn't have to be competing in triathlons. It can be walking, it can be a variety of things, but regular physical activity is good, and more tends to be better.
So what do you tell somebody if they say, well, I'm active, I get out of bed and I do things during the day and I end up going to bed at nighttime, but they don't have a set pattern. Do you ask people to have a set pattern of activity?
If I think it's advantageous for them, yes. So I think if they're not overweight and if they're sleeping well, eating well, and don't have a set pattern of physical activity, I don't know that it's worth trying to change that, because sounds like it's working for them. But if it's not, if they're overweight, if they're tired, if they're not sleeping well, then I think we need to look at how we can change that.
Now, a lot of people just don't feel good. I just don't have the energy. What do you look for when somebody says, I'm just tired all the time, Dr. Ely? What do you think of?
Tired all the time is very common, and there's 100 causes, and it can be things like low blood counts, thyroid dysfunction, kidney liver dysfunction, sleep apnea, and other medical issues. But it's oftentimes related to lifestyle. They're not getting enough sleep, they're not getting good sleep, and they're not prioritizing their lifestyle to help them feel better.
Is that easy to pick up on? Sometimes yes, sometimes no?
I'd say sometimes yes and sometimes no.
Yeah. When you look across the table at somebody from your office, can people be too thin, look too undernourished, look too like they're training too hard?
They can. Of course, there are eating disorders in young women, but also in young men, and older men for that matter, but they're not as common in older men. Anorexia, bulimia, those tend to lead to being too thin with a body dysmorphic picture where they don't think they're too thin. Of course, people can be too thin because they don't eat well, don't eat enough, or have a medical condition that causes them to be too thin.
Every time they come see a doctor, do they get their blood pressure taken and their pulse and their height and their weight? All those things are important.
In our office, they get almost all that every time. It's not actually recommended that we do it every time, but certainly try to do it every year.